Hello everyone, my name is Chris Rechungura and I'm part of the Ocean International Community Church, and I'm here today to spend a few minutes with you to just speak with you about the current pandemic that we're in the middle of, and we as an organization, as a church, what can we do to help with the efforts that our government is doing to reduce the spread of COVID-19. Over the past few weeks, we have done several projects helping through health facilities with masks, helping the prisons with soap and things like that. But recently, we've decided to engage in a much bigger scale project, and we're doing that by assisting the initiatives of a local organization actually called Water Mission Tanzania that is doing a much bigger scale countrywide initiative to help the efforts of the government to reduce the spread of COVID-19. And so we're actually here today with Benjamin Filskov, who's the country director of Water Mission Tanzania. And we've invited him today to give us some insight of what Water Mission is, what the project really is, and how we as individuals and as organizations can actually come together and help in those initiatives as well. Benjamin, welcome, and thank you so much for joining us today. So let's begin with you just telling us a brief of who Water Mission is and what exactly do you do here in Tanzania.
Water Mission Tanzania has been working in the mainland of Tanzania since 2013 by providing sustainable, safe water solution to rural communities, to peri-urban communities, to emergencies. When I say emergencies, I mean flooding disasters and refugee camps in the western Tanzania, and then lately also to hospitals with safe water solutions and hand washing facilities.
And recently you've now been engaging in providing these hand washing stations, across Tanzania. Could you tell us a bit about that specific project? How did you come up with that project? Was it a need that was brought to you, or was it an area that you saw you could help and you just jumped in?
After my team and I, we visited a few hospitals in Dar es Salaam. We really quickly realized the urgent need to respond to this matter, because we saw that there was no hand washing facilities at the entrance of the hospitals. That's why we designed a solution that meets the unique circumstances for the environment by a very large tank for water, and then with taps and soap dispensers for people to wash their their hands. Sorry. There are often water scarcity. Sometimes there are interruptions in the water supply that can last from a few hours to several days. And that means that with smaller tanks you can't refill and for people to wash their hands properly. So a large tank that would typically be between 250 liter and 500 liter.
Very good.
Our first solution was 500 liter, but now as we're stretching further beyond the Dar es Salaam region, then we are also targeting smaller health facilities where a 250 liter is sufficient.
So what is the scope of this project? Because now you're saying you're stretching beyond Dar es Salaam.
We would like to reach all regions in Tanzania. At the moment, we are responding to Dar es Salaam, Pwani, and the Dodoma region. Soon this week, we're stretching further to Tanga and Mwanza, and then hopefully we'll be able to respond to all regions in Tanzania, depending on funding. Our target is 1,000 health facilities and isolation centers. We have now reached 250 health facilities and isolation centers. Very soon we're reaching to serve 1 million people with hand washing in Tanzania, and our target is 2 million.
What kind of health facilities are you looking to help?
we're collaborating closely with the Ministry of Health in Tanzania, and they are putting us in communication with the regional medical officers who are providing us with prioritized health facilities, either hotspots or health facilities that are crowded at the moment, to prioritize them in order so that we can reach the most important ones first.
But earlier, also in the discussion, you mentioned one of the biggest challenges you're facing is logistics and transport, delivering the stations to the areas. So I want to assume that anybody who would be willing to come to volunteer or has a vehicle they could donate to support the delivery, they would be able to assist that way. Is that something you would accept?
Yes, definitely. We would warmly welcome anyone with a pickup truck or a driver to drive out the health to the health facilities with the hand washing stations. That would be very much appreciated.
Benjamin, thank you so much. I think we've gotten quite a bit of information, but also as the church, we've decided to join Benjamin and Water Mission Tanzania to support this initiative because we see the scale of it. And as you heard, it's an opportunity to reach millions of people every month, thousands of facilities across Tanzania. And these are people who are working in the front line, risking their lives to keep us safe. So let us just come together and join. And as a church, we've created a platform for you to be able to give. Now, as an organization, just to inform you, we've already started working with Water Mission Tanzania. We've been able to donate the services of one of our vehicles and one of our staff to help deliver those facilities. So we know exactly what the need is, and we know exactly what Benjamin is talking about when he says that that's one of the key challenges. So if you're out there and you have a pickup truck that you're not using, that's sitting in the backyard, this is an opportunity for you to put that to good use so that it can actually work to help the efforts that the government of Tanzania is doing to reduce the spread. But also have a goal as a church in the next 30 days to raise $15,000. Now, we don't have to stop at that $15,000. If you can give more, please go ahead and do that. So right now on the screen, you will see different ways that you can participate and give financially through our online platforms. But also we have set up a VODA LIPA number that's dedicated to receive those funds specifically for this project. And the LIPA number is 555-4444. That's 555 quadruple fours. So if you just send your offering or your giving to that number, 100% of what we're going to collect in the next 30 days in this project will be given straight to Water Mission to help their efforts to reach more people. There's a saying that says, if you want to go fast, go alone. If you want to go far, go together. And we want to come together, and we believe if we join hands, if you give a little bit and I give a little bit, we can actually raise enough to help Water Mission and other organizations across the country that are working hard to make sure that we eradicate COVID-19 in this season so we can go back to normal lives. Thank you very much, Benjamin. I appreciate your time. Thank you for making time, and may God bless you for the efforts you're doing to keep this country safe.
Thank you very much for participating.
Thank you. I would shake your hand, but we can't. So, yeah. Thank you, guys.